I'm Dr. Amir Hannan, a GP at Haughton Thornley Medical Centres in Hyde, Greater Manchester in the UK, and I'm chair of the World Health Innovation Summit. And today I'm here with my colleague, Gareth Presch, who's the Chief Executive of the WHIS.
Hi, Amir. Pleasure to join you here in Manchester. I guess I'm in Manchester. I had a meeting earlier with Rotary. I'm here sort of talking about the work that we've been doing with the World Health Innovation Summit and how we're empowering people to manage their own health and well-being. Very exciting stuff coming down the line.
It's been a very, very challenging time for those of us in healthcare, not just here in the UK, but throughout the world. I think it is very exciting that people are living longer, but with that come a whole load of challenges, including people living with multiple conditions, long-term conditions, that impact on their health and well-being. We've got an aging population with fewer and fewer younger people who are looking after an older population that has greater needs. And that makes it very, very difficult for people. On top of that, there's unrest, there's concerns about the economy, there's concerns about social care, education. Cities are growing more and more and they're becoming unsustainable as a consequence of that. Doctors, nurses, healthcare professionals are leaving because they can't cope with the demand that's coming through. And as a consequence of that, we wonder about where the future is going to be. The resources that exist within the public sector, within the private sector, and even the voluntary sector are nowhere near what's available within the community, within families, and what individuals can do. The average diabetic patient might spend about 3 hours in front of a healthcare professional here in the UK per year. But where do they spend the rest of their time? The other 5,997 hours when they're not in front of a doctor or nurse. And I think that's where there's an opportunity for us to think about what we can do to empower people. So, Gareth, what kind of things are WHIS doing that could support people?
So yeah, Amir, we prototyped, we had a proof of concept, we were an event, an activity. That's what the World Health Innovation Summit, it's a platform. We want to empower people to manage their own health and well-being. You might be saying, well, how do you do that? Well, we do it through programs within the community. So you start off with an event, an activity, and you can have a mass gathering, but then you deploy solutions. So the programs that we had, WHIS Kids, WHIS at Work, WHIS Seniors, they deal with the sort of elements that you're talking about, the social determinants of health, the activities that are outside the realm of healthcare per se. So mental health and well-being, giving people the tools at an early age. That's what WHIS Kids is about. WHIS at Work, stress management in the workplace. WHIS Seniors, falls prevention, loneliness, quality of life. And then, of course, the environment, energy, waste, and water through WHIS Green. Our platform incorporates all elements, the elements that you talked about for diabetes, for example, outside the health system. That's what we're talking about. We're talking about a preventative model of healthcare here that is proven, that improves people's health and well-being, but also has an economic benefit. If you look at the UK for at the moment, 2.5 million people with ill health, it costs the UK economy 150 billion. This isn't just a UK problem, this is a global problem. If you talk about staffing, we're not going to have enough staff by 2030. We'll have a 10 million shortfall globally. So we need to come up with new models, new ways of operating within the community to empower them to manage their own health and well-being. That's what the World Health Innovation Summit is about. It is very much about a local activity, but thinking globally. And it's, supports the Sustainable Development Goals, but it's about empowering, it's about building trust. It's about being transparent. That's very much what we're about. And it's about bridging into the financial resources that are available. So when you talk about the economics, health is wealth. If you're unhealthy, if you're not fitting well, you can't have a job. It has a huge drag on the economy. We want to create new businesses. We want to create circular economies, new business models. We want to transform healthcare through innovation. We want to look at the life sciences. How can we create a model of healthcare that's based on prevention, which then creates new jobs? So in the UK, for example, you've link workers in social prescribing, but we want to look at new tools. How do you bring care to home? How do you develop the new tools for preventative medicine? We have plenty for disease management. What about preventing disease? So I'll just give you a practical example. Hearing aids, for example, solar ear is one of the projects we're working on. With the problem with a hearing aid is in lower middle income countries, you don't have a battery. We want to develop solar hearing aids. these are the sort of solutions that we're bringing together. So do check us out. It's very exciting times. We've got a massive opportunity to work with investors. If you're a family office, philanthropic donors, sovereign wealth fund, pension funds, contact myself and take a look at our website, www.whis.world, and let's see how we can transform healthcare from disease management, from a sick care model to a healthcare model, which is preventing disease and giving people the tools to manage their own health and well-being.
And certainly from my point of view, the thought that we could have patients and families and communities who are able to look after themselves to take a little bit of pressure off healthcare systems so that we can really focus on those who really need us would make a huge difference, not just for me and my patients, but I think for those watching this video thinking about where does the future lie. And it will be a mixture between helping people with diseases, but increasingly about health, wellness, and trying to prevent problems from occurring in the future.
Absolutely. And you need to understand, so anyone listening to this, think about, so there's 8 billion people on the planet, but 3.5 billion, almost half the population, have no access to healthcare at all. So what we want to try and do using the technology is to enable those people to have access to healthcare, to have, those simple, the opportunity to diagnose at home, for example. And these are sort of new technologies that we're developing. We're working with partners. We want to engage with local communities. We want to come up with solutions that are local. We want to feed back so that we bring investors locally so we can solve problems locally. And this is all about health as well. Absolutely, it's critical to make the link between the local economy and your health and well-being, and also ideas. If you have an idea out there, you need to get it out there. You need a springboard. You need a platform. That's what we want to provide, is a platform for ideas, for job creation.
Thank you very much, Gareth, and look forward to speaking to you again.